It is just a huge honor for me today to be podcast interviewing Isha Woodhams all the way from Hawke's Bay, New Zealand. So you are officially a Kiwi. Tell everyone what a Kiwi is. It's a flightless bird, right?
Yes, and it could be a fruit, but generally they're New Zealanders.
So when someone calls you a Kiwi, is that fun and with a term of endearment, or is it a slang negative?
No, being a Kiwi is great. It just shows that you like traveling, and New Zealand is a place of innovation, so it's a lot of fun.
Would you consider yourself more a flightless bird or a fruit?
I think a little bit of both. A fruity, flightless bird.
A fruity flightless bird. And then you guys, your big rivalry is Australia, and you call them what, Aussies?
Yeah, those guys.
Those guys. And when you're what's the most competitive thing that you guys rival New Zealand is? Is it yachting? Is it soccer? What is it? Cricket? What is?
It would be rugby and league.
What would it be?
Rugby and league.
Rugby and league. L-E-E-K?
No, league. Like
oh,
the
league.
Yeah.
So league rugby?
Yeah. It's,
okay.
I think they just have different rules. It may be a different game.
So actually, what's the most counterintuitive thing about rugby is when any American watches it, they think, well, shouldn't all those guys have helmets and pads on and all that stuff? And the bottom line is you actually have more injuries with helmets and pads. It's so counterintuitive. Like boxers would never punch you as hard as they could in the head, except for the fact they have gloves on. It's like you wouldn't punch a brick wall, but if you put a 14-ounce glove on, you'll punch that brick wall. And when you put a helmet on a rugby player and call it American NFL football, then they dive head first. And I mean, I think they should apply that to cars. Like I think cars do it backwards. Like cars put seat belts and airbags, so it makes you feel safe, so you drive faster, and 30,000 Americans die in their car each year. I think they should take out the seat belts and the airbags, and right on the steering wheel put like a 8-inch knife just sticking right out of the steering wheel. And you get in that car, no seat belt, no, you say, damn, there's a dagger right next to my heart. I better, and everybody would be driving real slow and cautious. But you take out that dagger, and you put on seat belts and airbags, and you put helmets on the rugby players, and you put pads on the boxers, and then all mayhem breaks out, and they all think they're doing, and they all call those things safety items, and they're not safety items because they make you feel safer. So then you take extraordinary risk and then end up dead, concussions, all that stuff. But rugby, I never forget when I saw that rugby game the first time, I thought, well, what is wrong with these people? Why don't they put on helmets?
They are pretty extreme.
But they don't use their head as a weapon like they do in NFL football where they wear a helmet.
Yes, that's correct.
And when boys punch each other without gloves on, they do body shots. They don't do head shots because your hand would break before your head. But anyway, so Isha graduated from Otago University Dental School in 2009. She moved to coolest little capital city, Wellington, where they get winds up to 100 miles an hour. After working and living in Wellington for 7 years, she learned the love of good music, food, and great dentistry. She also got an MBA from the Victoria University in 2014. This was a lens into the weird world outside of dentistry. She now lives in the sunniest place on earth, Hawke's Bay. She practices at a corporate chain, Lumino, the dentist dental clinic, and she is also under Jedi training for her favorite dentist and mentor, Dr. Gary Winter, and is learning implant placement and restoration. I think you're so damn cool. Tell us about your journey. Tell us about, well, first of all, why do they call Lumino the dentist dental clinic?
Lumino, the dentist, they started in 2002, and there was, I guess it came into inception after a group of practices got bought out from private equity by Abano Healthcare. And
by what healthcare?
By Abano Healthcare. They're listed on the stock exchange.
How do you spell it? A-B-A-N-O?
Yes, correct.
Abano Healthcare?
Correct.
And is that only dental?
They used to have radiology and audiology as well. So they're kind of horizontally diversified in the medical industry, but their focus in New Zealand has been Lumino, and they have 100 practices, which is just huge for a country the size of New Zealand, because we only have 4 million people here, Howard.
I know. I live in Arizona. It's got 6 million.
That's fantastic. We've
That's why.
done pretty similar things.
Just think how different Lord of the Rings would have been if they would have filmed it in the desert instead of New Zealand.
Yeah, Arizona's hot, eh?
That would have been a completely different movie if they would have shot it out here. But so you work for the largest corporate dental practice chain in New Zealand, Lumino, which has 100 practices.
Yes, and I think it might be slightly more now. I've lost count.
And how long have you worked for them?
I've worked for them for 18 months now,
And
and it's been a good journey. I got recruited into Lumino. I was actually at an MBA gathering. I went to an IT hackathon, and I was presenting a project saying dentists need something anyway. And someone was there from Lumino, and they joined my team, and they started talking to me about how great Lumino is. And I said I'll come to Lumino if they give me a job in Hawke's Bay, which they did. So I moved to Hawke's Bay, and we get to live in this great house. And my husband and I settled here. We've come chasing the sun.
nice. I love all those books behind you. All leaders are readers, and it's a shame. You know, I always thought I was the luckiest guy in the world because some great person would live, and they'd write an autobiography, and you'd think, my God, where this great person wrote an autobiography sharing you everything they learned through their journey, and you can read this in 4 or 5 hours. And then you look at your buddy, and he decided to spend those 4 or 5 hours doing something goofy. I mean, you could just learn so. I mean, every autobiography is someone's lifetime.
Yeah, let us talk about your book, Uncomplicate Business, Howard. I read about half of it, and it's amazing. I love the 3 principles that you've outlined in it. Learn to manage people, money, and time.
Well, that's a huge compliment coming from a dentist as yourself who also has an MBA. What was going on in your journey that made you go back and get an MBA?
Uh, I I guess I was curious about. I wanted to know more. In New Zealand, a small number of students get to become dentists straight out of high school. So I was 22 when I graduated from dentistry, and I was
Oh
working.
my God, are you serious? You were 22? You were
Yes.
barely old enough to drink, and you're already a doctor.
Yes, we drink a little quicker here in New Zealand. We start drinking at 18.
And
However, I've been practicing for a couple of years, and I thought actually I need to learn more about business, because it became very clear to me quickly that if you had to become a good dentist, perhaps you need to get good at being a good business person as well.
yeah, it wouldn't matter if you're making donuts or root canals or hay or movies. I mean, you just have to know business. And I also think that once you get an MBA, just like once you get a law degree or a dental degree, you never think the same again.
Now you see the world through a different lens.
Oh yeah, and I think of so many books I read. I mean, you can just name someone like say Thomas Watson Jr., the founder of IBM. I mean, the main takeaway was that he knew here's his entire journey. He grew up in this little town, and he noticed there were 3 hardware stores. And whenever he went to the hardware store closest to his house, there was a long line. So he'd get on his bicycle and ride to the other one because the other one had 2 clerks. And then after doing this, he realized that 3 stores, but one store had 1 clerk, one had 1 clerk, and one had 2, that the store with 2 clerks had that the market share was based on the number of clerks. So the one store with 2 clerks had 2/4 of the market, whereas the other each had 1/4. So he realized that sales had to do with the number of salespersons. So when he inherited IBM from his father, he said, the bottom line is this: if 70% of all the salespeople that sold computers worked for IBM would have 70% of the market. So he only focused on this IBM sales training school, and every 6 weeks they graduated a class of salespeople that all looked the same, had the same suit, the briefcase, all the talking points, the sales points. And sure enough, when he retired, he had 70% of the market. Then you go to the dental office, and the person answering the phone her job is named after a piece of furniture, front desk. She has no training. Nobody spent 6 weeks with her teaching her how to convert someone calling up saying, well, how much is a crown? Converting that into getting this person in here to meet the doctor like you. And just, I mean, I don't care what you do. If you don't learn the business, you're going to lose. And thanks for reading my book. And I can't think of any business book I've read. The story of Home Depot. I mean, that guy owns the Atlantic Falcons and was in the Super Bowl last year. But all those business books teach you so much. What is your favorite business books that you've read?
I like when I was this is really embarrassing, but I read a lot of I guess self-help motivational books when I was really young. They were around everywhere. I used to read a lot of non-fiction, but nowadays, like all the classics, Napoleon Hill, Jack Canfield. I like all of those because it's all about your personal journey and trying to maximize what you can out of your life and trying to understand how to do it better with potentially avoiding some of the pitfalls other people have. And I think that's the best thing that, in a book like this, Uncomplicate Business, you've already done everything under the sun with dentistry. And if you give me a sweet ass guide to say, hey, these are the steps, don't do this, don't do this, don't do this, 100% of that might not apply to me, but 99% of it, if applied, will kind of keep you pretty safe. So it's all about managing risk, I think.
As you're sitting over there on the other side of the world, do you think business is pretty much the same in New Zealand, Australia, the UK, and America, or do you think business is quite different between the UK, New Zealand, the Australia, and the United States?
I think people are the same everywhere. They have a collection of fears, they have a amount of money that they want to spend or resources and time, and they have a certain number of things in their social well-being and their health that they value. So it's more or less the same, I would suspect. And I think this is, it's universal.
So I'm 54. Are most of the dentists that are grandparents, 55 and over in New Zealand, are most of them boys? Has there been a big demographic change? Like, you're a female. Was your class half women, half boys, and were all the old guys mostly boys? Or has New Zealand pretty much always been 50-50 boys and girls?
I have met some dentists that graduated in the 70s, and there are certainly a few girls speckled around the place. But nowadays it's more than 50%. My class was, I think, definitely more than 50% female.
So a lot of people can't wrap their head around. They don't know until it's been done. They don't know, are women dentists coming out of school now more likely to say, you know what? I just want a Monday through Friday 9 to 5 job. I don't really, my lifestyle, my personal journey, I want to do all these other things. Do you think they're more likely to be employees, or do you think they're going to own their own dental office at the rate as the generation that went before them?
I think it will look different, Howard. Like, one of the key factors in doing the MBA so early in my career was just acknowledging the fact that perhaps my 30s are going to be tied up with childbearing and focusing on kids and being very maternal. So I didn't want to wait till my 40s to do my MBA. I wanted to do it earlier on. And I think for a short period of time, women still continue to do a lot of the heavy lifting in one way or another. Not necessarily always, but I think it's just changing. I think we're in the industry will look different, and not necessarily will mean that there might be more corporate chains, but there will still be some pretty good boutique dental practices. I think that's the private practice is here to stay.
What do the old traditional dentists in New Zealand think about this new corporate business model? Do they see it as fear, the end of the world, they're going to ruin dentistry like they do in America? In America, all you got to do is walk in the room. You can either walk in the room and say, boo, or you can just walk in there and say, corporate dentistry, and they all fall out of their chair and have a heart attack. How is the corporate dentistry being perceived in New Zealand?
You're joking. All these dentists are thinking, great, I'll get big bucks for my practice. Here's my retirement plan.
Exactly. That's so funny because when they opened up a dental school in Arizona, all these dentists went to the Arizona Dental Association. Said you have to block this new dental school. It was like 10 years ago. It's called AT Still. And they said you got to block it. You got to block it. You got to block it. And I'm standing there going, dude, who are you going to sell your practice to? A dry cleaner? Yeah. I mean, you got to think outside the box. I mean, someone has to buy your practice, but so do you? But did the old people, are they welcoming? Are the older dentists welcoming corporate dentistry, or are they afraid of it?
I think there'll be a mixed feeling. I mean, the people that have already done and sold into the corporate chains or have retired, they'll have a positive view on it because they see their practices continuing to thrive in one way or another and not necessarily struggling. But there will also be some fear and anxiety because they worry about the big guy cutting, I guess, margins and competition. But I think it's just different. What I did want to ask you, though, Howard, was you talk a lot about how Orthodontics Association of America failed in their corporate ventures, and there are lots of corporates that come and go. But what do you think corporate dentists need to do to succeed? Not the dentists themselves, but the corporations themselves. Well, I mean, if they're stay, what should they do differently?
Yes. So far, I think the business model of corporate dentistry is evolving rapidly, and I think it's very safe to say that the final business model has not been implemented yet. So orthodontic centers of America is what we would call in Wall Street a roll-up. So again, you had all these orthodontic practices that were illiquid assets because they were too big. So if you went to sell a house in Auckland, there's a price range where if you're selling that size of a house, you can sell it in a day, a week, or a month. But if you have way too big of a house, now the only person that can buy you is a multimillionaire, and most multimillionaires want to build their own house. So what they did is they went to Wall Street and they got a $100 million line of credit, and they started buying all these monster practices that were worth $2, $3, $4 million a year. Well, what kind of orthodontist can do $2, $3, $4 million a year? Certainly not the average orthodontist who walks out of ortho school at your age at 22, 23, 25. So they would buy this practice. They'd tell the orthodontist he had to stay there 3 years. Well, 3 years and 1 minute, he took the money and retired and ran. Then they put some kid that came out of ortho school an hour ago. So that $2 to $4 billion practice now shrank down to $1 million. So it was a liquidity play for illiquid dental assets. So now we look at all these chains that are going out now, and the biggest problem they have now, and the reason that none of them in America have gone public, and that would be a red flag for me as an investor in these publicly traded dental chains that you see listed in Australia, New Zealand, and Singapore, is that okay? Well, why are there none on the S&P 500? Why are there none on the New York Stock Exchange? Why are there none on the S&P 500? And it's because they grow with debt. So most offices, if you bought a business for $1, after a period of time, you'd want it to make so much profit that you build another store. So 1 turned into 2, and then 2 turned into 4, then 4 turned into 8, then to 16, then to 32, and it's growing from cash flow. But what these corporate chains are, they mostly grow with debt. So every time they'll buy $1 million practice for $1 million, and then their sales go up $1 million. So then when they go to 2 million, they borrow another $1 million. They got 2 million in debt. Then they go to 2 million in cash. So by the time they get to $1 billion company, they got $1 billion of debt. That's not very sexy for Wall Street. Wall Street would rather say, I'd rather loan you $100 million, and then in 5 years you have no debt, and you're doing $1 billion. But so they're very debt intensive businesses. That's why I think if I was trying to go public, I would only lease. That would free up a lot of the debt. I would only buy the businesses. I would not buy the land and building because it just looks really ugly on your balance sheet when you went and bought the land, the building, the practice. And then the problem they have is the biggest problem they have is in which all dental offices have is nobody keeps their associates. Getting dentists to all get along is like herding cats. If you got 100 flightless kiwi birds, they're not going to listen to anybody. And the people who listen the most and the best are like boys under 18 in the Army, the Navy, working at Walmart. You get a bunch of young, not very educated people that'll take orders. But by the time they've become a physician, a dentist, a lawyer, everybody knows everything, and you can't get two of them to agree on anything. So it's a very tough situation when all your employees are doctors of dental surgery with 8 years of college. Like you say things you can't cannot live without. Like you go into corporate dentistry, their mind is blown because the MBA will sit there and say, okay, we decided we're just going to go with 5 burrs, and every burr block is just going to have 5 burrs. Then you have dentists completely have an emotional meltdown and need psychiatric treatment because they can't do a crown prep without like 12 burrs, and his 12 burrs are completely different than your 16 burrs. And the MBA's guys are like, dude, it's a filling. Are you telling me you need 12 different burrs for a filling? And your 12 burrs, Howard's 12 burrs can't be the same as Isha's 12 burrs? And to get Isha and Howard to agree that we're going to do all of our fillings and crowns with just 5 burrs on the same burr block, then we both quit. Say, screw this. I'm going to open up my own place. I mean, you can't get 2 dentists to agree that today. You know why you can't get 2 dentists to agree that today is Thursday? Because right now it's already Friday in New Zealand.
That's correct.
Yeah, so that's where that joke actually comes from.
You're
you can't
in the wrong day, Howard. You're in the past.
Well, I can tell that you're ahead of your time, and I'm a day behind, no doubt. And then here's another problem. The way humans are, they have to have hope. That's why every culture's had religion. They have to see hope. They have to see light at the end of the tunnel. But when they go work at corporate, they're going to be an employee for the rest of their life. Whereas in law firms, what they do is they say, Isha, if you just really, really work your butt off and you bring new customers and you really grow the business, you know what we're going to do, Isha? We're going to make you a partner. And a partner is different than an employee. You can fire an employee at a whim and they have no say. I think the next business model that I would look at for dental corporate chains, they could learn a lot of lessons from law firms. In fact, Ryan, what we should do is we should look for some of the greatest American partnership consultants that know the ins and outs of how a successful partnership, because the lawyers have reduced their staff turnover by making their lawyers partners. And but I think when you work for a corporate dental chain and after 2 or 3 or 4 or 5 years, you realize, like, you're 30. If you worked for this chain from 30 to 40, are you still just going to be an employee? And employees don't have any skin in the game, and they don't see any chance of getting skin in the game. Now, if it's publicly traded, they could always pay you maybe every paycheck. Say they withhold 3% and pay you in stock. So after 10 years, you might have a sizable stock position, and maybe that would make you feel ownership. But I think if the humans don't feel like a partner and ownership, some skin in the game, and what I would recommend you to think about, Isha, is me being old enough to be your dad, is that we don't know where it's going, but we know what's not going to change. I mean, humans are still going to have teeth and want to eat and swim in the ocean, a million years from now. Some things are never going to change, and that's what you really got to focus on. What's not going to change? Because it's hard to predict what's going to change. But I do think that we see, like, how many kids do you want?
I would like 3 or 4.
Really? Now, your husband was one of 4 boys, like I have 4 boys. But you see birth rates plummeting, so it's a global phenomena that every generation has less kids than the one before it. It's a global phenomenon that they're getting married 10 years later than they did 75 years ago. So it's gone from 16 to 26 in the last, I think, 65 years. It's gone from 5 kids to 2 kids in the last 65 years. So you're 30 and you haven't had a kid yet. I mean, whereas when I was a kid, every woman had their first baby between 16 and 18. So that's why I'm thinking ownership could change too. I think if you decide, well, I'm not going to get married at 16, I'm going to wait till 26. I'm not going to have 5 kids, I'm going to have 2. And I think that same thinking, a lot of people might think, you know what, I don't want to really wear every hat as an owner. I don't want to be in charge of marketing, HR, payroll, accounting. I don't really want to do all that stuff. So I do think there will be creep. A group practice. I think it's totally trending towards group practice, but I just think that at the end of the day, if you don't control your employee turnover, I mean, and then there's corporate dental chains in America, some of the biggest ones, their average dentist doesn't even work there for a year. And when you go to their industry convention, they tell you that for 80% of your associates, your average, if you can get 80% of them to stay there 2 years, that's an A. 20% will stay longer. That's only 1 in 5. So then the question would be, what will make them stay longer? Is it a chance to be partner? Is it giving them stock? What is your thoughts?
I think corporate dentistry does offer a lot, and I think that's why so many young associates do flock towards it, because I think there's probably more pressure to be studying and less pressure to be, like out in the real world working. It's very hard to get into dentistry in a lot of places. So by the time you've got in, you're an expert in organic chemistry and not so expert in understanding how a business works. So going into corporates is a safe bet, but also there is a huge amount of affiliation that you get. If you really just care about just doing dentistry for a while and you just don't want to be bothered, then you do have some pretty good dentists and mentors that you can hook into within the organization. And I think dentists are artists, though, and I think this is where there is a divide between business people and the general public, is they still perceive dentistry to be a commodity. Like it's not milk is not milk bought anywhere. Because with goods that you buy at a supermarket, there's a level of standardized care. And whereas we're craftsmen, we're more like jewelers that make individual things, because our own clinical skills, they're not, 2 dentists just don't have exactly the same clinical skills or competencies. So getting 2 dentists to charge or act the same or use the same tools is just going to be impossible. So I think maybe corporate dentists just need to create more allowances for it,
And the other thing is every dentist has a different scorecard. Like most dentists that are artists think that tooth-colored composite is just beautiful. But then you look at the 100 million insurance claims, you say, okay, your bullshit plastic filling lasted 6.5 years. This ugly amalgam filling lasts 38 years. So what is an A? That it looks all pretty, or that it lasted 38 years? I mean, anybody who's 10 years old knows that metal is stronger than plastic, unless you're a dentist. And
metal is malleable. I think old school dentists.
Do they do amalgam still in New Zealand?
There is still a fair bit of amalgam. I stopped doing it a couple of years ago, not because I hate amalgam, but I thought at some point, somewhere in the supply chain, someone's going to say mercury's bad, we shouldn't produce amalgam anymore. And then I'll be stuck, unable to treat my patients because it's so much fun carving those things up. So I switched.
What's really sad is, regardless if we never place another one, we'll be dealing with them for 100 years. And the only environmental problem that's real is you still have people cremating humans. 6% of the mercury in the air and the ocean is from cremating Homo sapiens with silver fillings in their mouth, where 50% is from coal. Now you should really, I'd rather they go after coal than teeth. I mean, you know, you could go to nuclear, wind, solar, but somebody in every state, country, county has got to realize that somebody needs to pass a law that you can't cremate a human until a dentist, an assistant, a hygienist, someone has got to inspect that body and pull them damn molars out, because you can't bake them until the whole damn human turns to ash. And I also feel sorry for the person working in the crematory, because they have no idea what they're doing. I mean, they're heating mercury up to 400 or 500 degrees. I mean, they're turning you into a quart of ash. Where do you think all that mercury vapor went?
Well, what about the dental surgeries? What percentage of the surgeries air as mercury released, do you reckon, Howard?
Yeah. So it's quite a so getting dentists to agree on this. They're not going to agree on the burrs. They're not going to agree on amalgam or composite. Or look at the other composite with an active ingredient, glass ionomer. I mean, why is it that it's 10 times more popular in Australia, New Zealand, and Japan than in the United States? You almost never see glass ionomer used in the United States. Do you use glass ionomer?
Yes, I do actually. It's great.
Okay, you're talking to a bunch of American dentists who are listening right now who probably haven't used it one time in the last year. And who's your, you got one of the smartest glass ionomer guys down there. There's a couple of them. One's Graham Millicich. You know Graham?
Yeah, Graham's amazing. He's just a huge role model for me and a huge idol. I just think he's so ahead of his time.
Well, tell that bastard that Howard said to come on this show. I've sent him a request 5 times, and every time he emails back, well, I'm on vacation. Well, I'm going sailing. Tell him Howard doesn't give a shit if he's on vacation or going sailing. He needs to Skype me for. I think Graham Millicich in New Zealand, Jeffrey Knight in Australia. He went from Vietnam to Adelaide, Australia, but now I think he's in Dubai or something. But that's probably one of the 3 of the top 10 smartest people in dentistry alive today. But it was, so let's go back to that. I mean, talking about a scorecard, why do you think Graham Millicich in New Zealand loves glass ionomer more than all the dentists in America?
I think it's what you know, what you get familiar with, and what works. So something might be an amazing product in somebody else's hands. However, if you've never used it, it's not familiar to you, and it feels weird and different, and you have nothing to compare to, it will feel weird. My boss, interestingly enough, in my first job, not a corporate dental chain, just a group practice, but he came in, he's actually an accountant, and he said, "Oh, Isha, we've changed your glass ionomer cement from GC to Riva." And I was like, "I'm not touching this thing. I used it once." And I was like, "Nah, not for me. I just decided." And he said, "What is it? They're exactly the same. You look at all the studies, but the products are the same." And I said, "You'll come here." He said, you guys are not mixing it right. I bet you're not using that amalgamator right." So turns up at the practice, mixes the GIC, and he squirts it onto a cup. And he looks at it, and I'm like, "What are you looking at?" He's like, "Look, it looks good." And I was like, "How many times have you done that with any other type of GAC?" Eventually he gave up, and we went back to using the old GAC. But it's great, it's great for stabilizing caries. I mean, a lot of the erosive mouths, you can't really put composite, because composite relies on bonding, and that's why you see a lot of these rampantly failing, and the cements are really, really good for that. You can't just very quickly stabilize a full mouth. I went to volunteer in Peru a couple of years ago, and I took boxes of GC over there, and it was really great. It was the dentists over there, they tried them, and they're like, "What is this magic material?" And it will work in anything. It's like amalgam, It could be sloppy, bloody, patients coughing, drooling, whatever, screaming, kicking, and that GIC will stick.
You're saying GAC or GC?
GIC, glass ionomer cement.
Oh,
Sorry,
glass ionomer cement. Okay, I thought you were talking about the brand name GC, General Chemical, out of Tokyo.
Yeah, but GC Corporation make the best GIC. I mean,
and where are they headquartered out of? Where do you think they're headquartered out of?
Are they aligned with Henry Schein? I don't actually know.
Well, they started in Tokyo, Japan, but they've moved to Switzerland. But I can't
Oh.
tell if they moved to Switzerland for tax consequences and left all. I wonder if it's really just a Japanese company still, but they're in Switzerland for tax purposes. I mean, I see that a lot. Like Apple Computer is actually based out of Ireland because they don't pay taxes. I mean, when people say, "Well, why does Apple have $100 billion in cash?" Because they don't pay taxes. They're headquartered out of Ireland, so that but all their operation and all their employees are in California, and their factories are in China, and their taxes are in Ireland. Pretty. This international world is pretty interesting, isn't it?
Yeah,
Like,
regardless of where they are, I would really like to go see them. So
yeah, and I'm pretty sure Facebook does the same thing. They're all their people are in California, and they pay all their taxes to Ireland. I mean, it's a very common scheme. But yeah. So where did you run into Graham Milicic?
he founded, I think, or he's a core member of a group called the New Zealand Institute of Minimally Invasive Dentistry. And I started going to a few lectures, and I thought, and this all happened because I stopped using amalgam and couldn't get the composite to work. I was like, I need to know more how the stuff works. It's like voodoo magic or something. So I started going to courses, and Graham's name kept coming up, and eventually I ended up in Los Angeles at the Biomimetics conference last year. And I think I sort of can bond something now.
Was that the first time you've been to the United States?
No, I went on a big road trip after I graduated around California, Nevada. I just got a really nice car and we drove around. We went to the World Series of Beer Pong Championships. It was great.
So you went to California, Nevada. You're all around Arizona. Did you dive down to Grand Canyon or anything?
Oh, no, I didn't actually, but next time I will.
Yeah, you should look at that. I mean, it took Americans almost 100 million years to dig out that canyon. It's a lot.
Slowly.
So you talk about things you cannot live without. You say rubber dams, IPS Emax, and horoscopic loose. Those are all amazing choices. Talk about those three.
Oh, well, that all has come from just like I was talking, learning about bonding, making it more predictable. I think if and when amalgam disappears, or even if amalgam is here to stay, our aging population in New Zealand, most of the patients live to 80 to 90. I have a handful of patients who are over 90 years old, and they still have all of their teeth, and
Are
one
they
big
women or men?
women and men actually.
Women or men? In America, if you go into a nursing home, there's 100 women and one man named Lucky.
That's great. He's not moving that fast.
So we still have, in the States, we still have the average woman living about 5 years longer than the average man.
That's pretty good. It's probably because they talk so much.
Actually, it's one of the biggest things in there. They think one of the biggest things is, well, you have 30,000 people die in car wrecks each year, right? Well, who pays higher insurance premiums? Who gets in more wrecks, boys? You have 30,000 that die from accidents every year. Well, who's the one falling off the roof in the tree? Usually boys. You have 30,000 suicides each year. Women actually attempt suicide twice as much, but they never complete it because women always attempt it with a butter knife on her vein, and she posts it on Facebook. I'm killing myself. I'm dying. But men always use a weapon. And so men, almost all their attempts are completed because they use a gun. But women always use like a butter knife or a knitting pen or...
And women and men are very different, but it's shown that men who are married to women do live longer than men who are not married. So there are general benefits with being associated to women at all, I think.
No, that's fact. The shortest living sapien is a male bachelor like me. The longest living woman is a female bachelor like my oldest sister, who's a Catholic nun. In her nunnery, I mean, every nun that's died since she's been in there for 35 years, they're all in their 90s or 100 because they don't have. So when men marry women, women's life expectancy goes down and men goes up. And then it's frightening for men over 65. If you're a 65-year-old man and your wife dies, half the men die within a year because they lost all their self-help of cooking and eating and cleaning, and they just
Oh,
stop cooking, and
that,
they just, and that's sad. Half of men over 65, if their wife died, and that just happened in America. One of the greatest companies out here, Patterson, and the guy Pete Frechette, who was the one who took it public and built this big old empire. And he was married to his wife for 50 years, and she died. I don't think he even made it 3 months. Richard Nixon, the president, when his wife Pat died, I don't think he made it 6 months either. Men just don't do well if they've been used to this lovely woman their whole life. She's just cooking and cleaning and making this life all happy, and then all of a sudden she's dead, and they just lose everything.
If it makes you feel better, Howard, I don't think so many women are excelling at cooking or cleaning these days. So maybe things change.
If you wanted to hide something from my ex-wife, I just put it in the oven, and she never found it. It was just filled with all kinds of stuff. Do they have fluoridated water in Auckland? What's the views on fluoride? Is that a communist evil plot that's poison, or do they accept it as science since they're an island surrounded by an ocean that is naturally fluoridated at 1.4 part per million?
Yeah, I mean, fluoride's a really interesting topic. I wasn't born in New Zealand. I was born in India and Hyderabad, and the groundwater actually has 6 to 8 parts per million fluoride naturally. And I have fluorosis on my teeth, but I just I don't know
How
how
many root canals and crowns do you have?
None.
So I'm sitting here looking at it. Now, granted, I mean, it looks like you have beautiful teeth. I mean, you have gorgeous teeth.
Thank you, Howard.
So are you glad that you had 6 part per million fluoride, which is 3 times the level naturally occurring in the ocean, so that you've never had a root canal and a crown? Or are you traumatized from that fluorosa and currently going to therapy because there's a spot on your tooth?
I was a little traumatized. I used to get aunties telling me to brush my teeth, but I think it made me more curious, and I did become a dentist after all. So, and I didn't have to get veneers. It just bleached out the brown stains that I used to have in my front teeth.
So you didn't get veneers. You just bleached them.
Yeah, those are my natural teeth.
All natural. Yeah, they're beautiful.
Thank you. Fluorides, there's an anti-fluoride network in New Zealand. They're more of a nuisance, really, more than anything else. Because the debate is, my kids don't need it. This is not the way. We don't want it. We want to have autonomy. But it's not about their kids. The people who are in the anti-fluoride networks or have the freedom to go into conferences, those are not the kids that will be struggling as a result of decay and neglect. And they're the kids that get decay. They're usually in very low socioeconomic conditions, and both the parents are working and they come from large families. There's often the food is very expensive in New Zealand, so their food choices aren't always easy. So the fluoride thing, I think it's here to stay until we can decrease the number of kids who are waiting on the general anesthetic list to get their dental treatment done. In New Zealand, kids actually get free treatment until they're 18. It's really great. It's a great service, and New Zealand is just exceptional. It's an amazing service. They go and check kids' teeth every single year.
Yeah, I've been involved in fluoridating Phoenix in '89, and then again that bill expired, and we had to do it again 20 years later, and it's just incomprehensible. In both of those debates, you just walk away realizing after you do this big campaign, and I'm debating on the TV, the radios, in front of the city council, and you walk away realizing that at least in Arizona, that 1 out of every 4 people is completely batshit crazy insane. I mean, it's kind of bizarre that 1/4 of Arizona is completely beyond logic.
Are they beyond logic because of exposure to the fluoridated water?
But even well-intentioned dentists, I mean, even some of the smartest dentists I know, a few are anti-fluoridation. And then when you talk to these people and you say, okay, well, mercury bond to silver, zinc, copper, and tin, and an amalgam is an insoluble salt. And if you swallow an amalgam, 24 hours later, it comes out the back door, and you can weigh it, and it's all there. And then they will sit there, and while they're telling you how toxic mercury is, they're eating popcorn shrimp. Because if I went in your swimming pool and threw a fork out on the swimming pool, it wouldn't float on the top, it goes to the bottom. Mercury goes to the bottom. The shellfish, the shrimp, the lobster, they eat all that stuff. And when they eat it, it's ethyl mercury, it's methyl mercury, which is totally bloodborne available. And they're sitting there eating popcorn shrimp, which would put mercury in their bloodstream, unlike a silver filling. And they're telling you how toxic silver fillings are, and they'll never do one in their life, while they just ate 6 popcorn shrimp and eating a serving of amalgam. And you're just like, at what point do you just say, let's just switch to the zodiac symbol? I mean, let's just base this whole argument on astrology.
I think this ties in really well with how you started the talk off, Howard, about how NFL players think it's ridiculous that rugby players run in without helmets. And I think human beings are not very good at assessing risk or statistics in a meaningful way. So, like jumping off flying in an airplane is very low risk, but some people are irrationally afraid of it, versus people get into car accidents all the time. You're statistically more likely to die in a car than you are in a plane. So I think human beings are not very good at assessing risk, and all dentists are human beings most of the time.
Well said. Beautifully said. I think we should start a campaign where Kiwis versus Aussies. The Kiwis will ban all seatbelts and airbags and put a 6-inch dagger on the steering wheel. And then the Aussies, they can keep their airbags and seatbelts, but they have to add helmets and shoulder pads when they drive. And then after 1 year, we'll see how many more Aussies died than Kiwis per miles driven. Or you guys say kilometers, right?
Yeah.
So yeah, exactly. And I can name 100 people that I know that are deathly afraid of flying in airplanes. Yet they'll get on these interstates on I-10 and fly 75 miles an hour down the road in a piece of aluminum. And it's because I figured that out. It's because when they drive, they're in control. And monkeys want to be in control. And when you're sitting in an airplane, you're not in control. You don't have a steering wheel. And for many, many humans, it's lost control. Why do you say there's a cracked teeth epidemic? Is that cracked teeth epidemic? Is that New Zealand, Australia, the whole wide world? Why do you say that?
I think the cracked teeth epidemic exists because our patients are living longer than ever. Before, there were cracked teeth, but they were just buried.
Well, it's funny you said that, because I got to ask you a question. I hope you're not offended by it, but today, it's all over the internet. I posted on Dental Town and Facebook and all that they just realized they found 130,000-year-old Neanderthal teeth that had dental work. And
yes, I know that.
Yeah, so does that mean that the world's oldest profession has now been dethroned and dentists are the world's oldest profession?
Of course, we've known this for a long time. That's why we stay doing dentistry, don't we?
I had no idea that dentists predated prostitution by 130,000 years.
We've been charging well ever since.
I think dentists should officially say, hey, we're the world's oldest profession, not the damn hookers.
I reckon you should definitely get it out. It's a public service announcement.
And we charge more than hookers, right? I mean, go. I'm sure you get a root canal build up and crown costs more.
I don't know. So
I want to make one point on your oroscopic luso. I think that for the young kids out there, that the bottom line key to being a better dentist is always magnification, seeing better. Whether it's you wear loops, if you're doing a root canal, get a microscope. When you scan an impression and you can see that impression 40 times bigger, that's anytime a Homo sapien can see better they can do better work. But the error is the doctor's the only one wearing the scopes, and then the assistants making the temporary, the hygienist is cleaning teeth. Anybody who has their hands in the mouth has to wear the oroscopic loops. You can't have, it's totally gross when the doctor says, well, I'm the important one, I'll buy the loops, so my dental assistant and hygienist doesn't need loops. I mean, everybody working in the mouth needs to see 2, 3, 4 times larger. And
Yeah. I think adhesive dentistry is tricky. I think amalgams, they work great, but a lot of the patients that come in, you can't even put another amalgam on their tooth because already there's a four-surface, there's a full occlusal coverage amalgam that's just come off. There's with a bit of tooth structure that was left retaining it has broken off. So then you have to go towards relying on some form of bonding and adhesion to make your restoration stick. And I think that is tricky because the mouth is full of saliva and wet things preclude any kind of sticky activity. So in this environment, I think loops or some form of magnification they will become the best practice standard. And what loops do is whether or not they make you better at treating people, what they do is they reduce your plausible deniability. You cannot live in ignorance once you see what the problem is.
Point out something very profound where, right now the dental software is designed for drilling, filling, and billing. It's really not based on anything to do with evidence-based dentistry. What are your thoughts on current day dental software?
Oh, every single one of someone in my age group will agree how horrific it is writing notes. It's a dreaded activity. Voice recognition has been around for years, and yet it's not mainstream in dental practices and dental software. I know some software is trying to get out there, but I really think also this is a big problem when dentists are assessing what their business output is because they're not looking at what the total disease they've diagnosed within their dental practices. They're looking at the total amount of treatment that is being done. And there is a big gap between how much disease walks in and how much actually leaves being treated because there's a whole bunch of intermediary factors, your ability to communicate value, your ability for the patient to pay, the demographics of the patient to have certain treatment done. And the treatment itself is not always indicative of their needs. So I think it's horrific. And interestingly enough, you brought up IBM, you brought up Watson Jr. and I wrote an article on LinkedIn about how I think Watson Healthcare should really succeed. And I see this becoming instrumental within dentistry. Dentistry is going to become a lot more predictable and we're going to reduce failures and it will become so much more standardized. Patients will get better care. Dentists will have less trouble communicating risk to patients. Hey, look, this tooth is really heavily root filled. It's going to fracture if you don't have full coverage restoration. If you have the facts in front of you, it's going to be easier to communicate that to the patient. And all of this other technology exists in dentistry, but I think we should go back to where the disease exists and the diagnostic software in dentistry, the ability to input information, it just needs to improve. And it needs to be easier. It needs to be integrated with my workflow. It needs to be easy for the dental assistants to do it. It just needs to improve, Howard.
I love you. I love your passion. I love I love your post on LinkedIn. That's how I contacted you. You didn't contact me. I'm a big fan of your post on LinkedIn. I do wish when you go through all that work and you post that on LinkedIn, you've already done all the work, you should just copy and paste it and post it on Dental Town too.
Love to, Howard.
Yeah, there's a 250,000 dentists over there, and I'm a big fan of your writings. Where do you think that comes from? Well, it's almost like you're half dentist, half philosopher, part poet, part artist. When I read your stuff on LinkedIn, I always think, a lot of people my age would call someone like you like an old soul. It's like, where did you get all that smarts at such a young age? What do you think it was on your journey that made you so philosophical?
I'm very extroverted.
Or is it all just alcohol induced?
Well, actually, interestingly enough, this alcohol induced. I started my I'm very extroverted. I love people and I talk a lot. Like you and I like to talk to all kinds of people. And when I was at dental school, I used to work in a bar called the Bowler in Dunedin. It was a student pub, but it had a select group of very aging older men and women that would just hang out at the pub and drink all the time. So I kind of like at first I was a bit like, oh, this is a bit gross, but then I eventually got to know them and I was like, ah, these are just people, but older and way cooler. They've hacked it, and then I had a lot of time to introspect and I didn't want to change myself. When I was very young and I was a teenager, I didn't like how talkative I was and how I can be without reservations. I'll talk to anybody, do whatever I want. But I've become more accepting of myself, and it's led to some great journeys. I have lots of friends who are like dentists who are 60 years old. They're just fantastic. They're so cool, and they're so great to talk to. And you get a lot of advice, and it just gives you an insight. And I think this is where corporate dentist chains, I think, could hugely capitalize on this market of aging dentists, because you even if they're no longer willing to pay for a practicing certificate, they're huge. Their knowledge capital is huge. Their ability to assess risks and patients is huge. They're a huge mentory resource, and we should make it possible for older dentists and actually older professionals in every profession to contribute back to society. I think it's amazing. It's a cool world we live in, and it's great that they're so healthy and they all want to travel and they want to do cool stuff and they actually care to talk to you.
It's so funny that you're a bartender. I have said for 30 years that most dentists could double their money if on the weekends they got a part-time job as a bartender and just learned how to talk. I'm dead serious, because the natural selection to who they let in dental school is based on who got A's in math and chemistry and physics. And I tell these guys that the number one thing that's going to carry you through dentistry is a chairside manner, being able to talk to patients, be able to talk to them without making them feel bad, not condescending. Don't put them in fight or flight, epinephrine, norepinephrine, but you got to make them secrete dopamine and oxytocin and serotonin. And your bartender does it because he wants a tip, and you want to do it because you're their doctor. And if you don't convince them to have their cavities treated and their abscess fixed, then they're walking out in an unhealthy situation. So you have to, I would always bank on the chairside manner. And I can smell it when I walk into a dental office. I can smell the balance sheet, because you either go in there and it sounds and smells like a library, and some lady at the front desk hands me a clipboard to sign in like I'm some, kangaroo cattle that has a branding on my butt. And then you go into the $1 million practice and someone will stand up and go, "Oh my God, how are you? How's the kids? Isha, what's your husband up to? Well, what are you guys doing?" You just smell the feel good, and you create that environment, then they will get their disease treated. And if you just focus on the disease, by the way, I still always love this quote: "The superior doctor prevents sickness. The mediocre doctor attends to impending sickness. The inferior doctor treats actual sickness." And you wonder how much time, you go back to when I got out of school. There was in the 87, there's a guy named Bob Barkley that was going around, and he spent his whole life until he went down in an airplane trying to get these doctors who were just pulling everyone's teeth and putting in dentures to start a hygiene department. And the pushback was, "I'm booked out 6 weeks in advance, pulling everybody's teeth, doing dentures. I don't got time for this baloney hygiene department." And look how far we've come in just the 50 years since Bob Barkley, who basically, he was going up against a wall trying to get these dentists to switch to preventing disease. The superior dentist prevents disease. The mediocre dentist attends to impending sickness. The inferior dentist is treating disease. And I love the fact that you're already thinking about evidence-based dentistry. The real value is when they come to you and you prevent disease, not that you're the fastest, most efficient tooth driller mechanic in New Zealand.
Yeah, I think innovation is key, and dentists need to innovate, or our value is going to become a commodity. Like patients can't seem to differentiate between coming to see me and going to Thailand, which is quite close, and New Zealand to have treatment done. And I think it's a reflection on the profession because everyone's competing on price, and then the patients go shopping for price. But I think I wanted to talk to you about um, what's happening with the Facebook groups. Yeah, there's a lot of, the dentists, there's some of the Facebook groups have 40,000 dentists. There's Australia, New Zealand one that has 10,000. But in 1992, was it that you established Dental Town and you wanted to bring all these dentists together, start talking to each other and collaborating? So you're a bit of an old soul yourself.
I started Dental Town in '98. Facebook didn't start till 2004. And it's amazing. I am basically, when I saw the internet, I've done everything because I needed it. I would only recommend something I did in my office. I would only talk about something a solution I found for my patients. And I'd put my 4 boys to bed and be 8:30, and I'd be sitting there in my chair thinking I'd give anything to talk to another dentist. I mean, I did a root canal, it swelled up. I put on PenVK. Should I have pulled it? Should I have added a metronidazole? I mean, I was always sitting there with a knot in my stomach, and everyone that loved me, like if I called my dad, he'd say, well, I'll say a prayer for you. If I talked to my mom, she's like, tomorrow morning I'll go to mass early and say a rosary. It's like, I don't want someone to kill a goat or go to church or sacrifice an animal. I want to talk to a dentist. And when I saw them talking on the internet, I just started Dental Town, and the motto was, with dentaltown.com, no dentist will ever have to practice solo again. And the main difference between Dental Town and Facebook, mainly because Facebook has not even dented our traffic. I mean, we still continue to grow 1,000 new dentists a month every month since 1998. I think it's the tribalism. So if I'm one of your friends on Facebook and you put up a root canal and I say, Isha, that's horrible. You're short. You missed a canal. And you need to redo the whole thing, well, you just unfriend me. So Facebook is these little tribes of everybody patting each other on the back, telling you you're wonderful. Whereas Dental Town, you go post that root canal in front of 250,000 dentists, and there's anything wrong with it, someone's going to find it. So Facebook is where you want to go to hear what you want to hear. Like join an anti-fluoridation group in Facebook and start telling him the virtues of water fluoridation. You're deleted instantly. You're unfriended. Just like it'd be kind of like if you're Catholic and you go to a Hindu club and start telling everybody they should convert to Catholicism. You're gone. But so in Dental Town, it's one of those deals where now you have to do it friendly because we have a report abuse button. And if anybody ever says anything and it makes you feel bad, you hit the report abuse. And we have like 12 volunteers that look at it.
Howard, how many people go to the townie meeting? What's that like?
We do that every year. Basically, what that's like. So let's say I talk to you every day on Dental Town, but I couldn't pick you out of a police lineup. You're anonymous. Your name is Smiley Tooth, and so basically, it's just a bunch of townies. It's about 1,000 dentists from Dental Town, and then this is what you see all the time. They'll say, "Hi, what's your name?" So, my name's Isha. What's your name? My name's Howard. Oh, what's your name on Dental Town? And you say Smiley Frog. Oh my God,
Oh
Smiley
God,
Frog! And the reason we're anonymous. That's another difference in Facebook. Facebook, you have to be there. So here's a big subtle distinction. Facebook, when I follow Isha on Facebook or LinkedIn, I know it's you. I can go to the about. So the reason I won't do that on Dental Town is I feel what's best for the sovereign profession, there has to be a place to ask a stupid question. That's why on Facebook, everybody always posts their best root canal, their best implant case. It's all showing off. And everybody on Dental Town wants me to make everybody have to be transparent. But I say no. I've lectured 1,000 times. You say, are there any questions? And everybody says no. So you go to break, and then 5 people come up and want to whisper a question to you because no dentist wants to ask a stupid question in front of all the dentists. So what I think what's best for the sovereign profession of dentistry is that you can go. Now, you have to register. I know who you are. But when you go into Dental Town, you could remain anonymous because some of these guys are like endodontists. Imagine you're an endodontist and you post a failing root canal case. Now all the general dentistry area is saying, my God, don't send to that guy. He's the idiot on Dental Town that posted that root canal that was upside down and fractured and broken. So I want there to be an anonymous place where a dentist can ask a stupid question, because I've seen that phenomena lecturing for 30 years. And I want what's best for dentistry, not what's best for anything else. And I love Dental Town. Like I say, if you're already making that
Sorry, I just have one more question for you.
Okay.
Did you face any challenges when you were trying to establish Dental Town? Because you're a dentist, and what do you know about computers? And what was the journey like going and trying to get a forum set up and trying to get your head around it?
Well, I'd say the interesting thing was at that time in '98, there were actually about a dozen dental companies trying to do the exact same thing. But they all went and borrowed a bunch of money. They all got a bunch of venture capital money. One of them was called Dental Exchange and raised like $20 million of capital. And I always said, dentistry is not a sprint, it's a marathon. And I hired a programmer, but in my dental office, and I had no overhead. I was lean and mean. And I said, the turtle will win at the end of the day. And we just went slow, and we went slow, and we focused on the customer, and every one of those other companies is gone. And we're the only one that survived, and we only survived because we kept it plain and simple and our costs low, and we worked it all day, every day. When I started it in 1998, not one single person, my father, my mother, my ex-wife, my dad, my sister Shelley, and my ex stood in the kitchen one day, the entire day, just trying to talk me out of that this is just a stupid idea. It was AOL. How old were you in 1998?
I was 11.
11. Do you remember the AOL dial-up?
Yes, I do. The crank.
Yeah. And everybody said this is stupid. It's never going anywhere. But I just kept thinking of only one thing. And that is, how nice would it be after all the kids that went to bed, just to share an x-ray with another doctor and say, what would you do? And I knew that for me, for my own selfish me, I wanted that so bad that I didn't know, how could I want that so bad and nobody else want that so bad? And now social media looks obvious. I'll tell you the other funny things where people don't see markets. Do you realize that the planet had silent movies and phonographs for 40 years before one monkey thought, why don't we add the phonograph to the movie? 40 years, and not one human thought, well, let's try to put chocolate on my peanut butter. And that's what you did, that you added the movie to the still movie, you added the chocolate to the peanut butter, you added, what you and I have in common, you added an MBA to a dental degree. And the whole is greater than the sum of its parts. So a dental degree is 1, an MBA is 1, but 1 plus 1 equals 3. And the whole is always greater than the sum of its parts. And whenever you're on your journey and you add another book, you add another degree, the whole's greater than the sum.
And how did these first dentists join Dental Town? Who were these people and how did you find them?
Same way building a practice, it was all word of mouth referral. It was just simply word of mouth referral. One guy, when something works, you want to share it with your buddy. And when you register, we said, well, how did you find out about us? And it was always a name of someone else who was another member. So when you look at Google, Google never advertised one time the first 20 years. Not one ad. They did a search, and there were already other search engines, and people would say, oh my God, try searching on Google. And then she tells her sister, try searching on Google. And the thing just had exponential growth, and there was no advertising. So if you're really doing the right thing, your customers are going to tell people. So the people have to spend all their money on advertising and billboards and direct mail and Google ads and all this SEO. It's because they don't have any raving customer patients that are coming home, going back to work and saying, my God, I swear to God, if you ever go to the dentist, you need to go to my guy. I didn't even feel his shot. And a painless shot is worth more than a laser and a CAD cam and all the other bullshit. A chairside manner that makes you giggle and laugh and feel good is, imagine if your girlfriend said to you, say you were looking for a woman doctor and say, oh, you should go to my woman doctor. And you said, why? Well, she has an MRI machine. She has a IBM XQ5 MRI machine, and she's got the new Cisco GXQ ultrasound machine. That's how dentists talk. Like anybody gives a shit what type of ultrasound laser. I mean, if you go into an OBGYN, you're going to get referred by your girlfriend who loves her OBGYN because she makes her feel good, not because she has a new Cisco router ultrasound or the new IBM bullshit mainframe MRI CAT scan rolled into one. Dentists talk about these trinkets like they matter, and what matters is how you make people feel.
Great. Thank you for everything, Howard.
Thank you, and tell Graham Millicich that I'm going to fly over there and hit him over the head with a dead kiwi bird.
Come to Hawke's Bay. It is so nice and sunny, and come to our NZA MID meeting. It's usually in September. And Taupo, it's beautiful.
Well, tell Graham if he comes on my podcast, then I'll go down there and lecture with him, or maybe you. But anyway, I'll be in Melbourne, Sydney if you're in the neighborhood, and tell Graham that you were the first and the greatest Kiwi to ever come on my show. That he's got a big trails to follow. Oh, there's also a big.
It's actually not true. There was Dr. Andrea Shepperson who came on your show.
That's right. I forgot. I stand corrected. And there's a big dental company that makes a matrix. Is it Triodent?
Yes, Triodent, and now they're sold to Dentsply. Yeah, Simon McDonald established.
Simon McDonald. I want to podcast him. That was that's before your time when composites.
I can send him an email and tell him.
Before your time, when the composites came out, we only had the same stuff that was used for amalgam. So we had the whole amalgam armamentarium, and we were trying to do composites. And Simon McDonald?
Yes, correct.
He was the first one that said, no, an amalgam matrix is not going to be ideal for a composite matrix. And I love that sectional. What's it called? The Triodent sectional matrix?
Yes, they're fantastic. The V3 and V5 systems, I think, maybe V3.
Well, can you do me a favor and tell both of those Kiwis that I want to podcast them?
I will tell them.
Okay, and thank you for
come to New Zealand soon.
And thanks for all the articles that you wrote on LinkedIn. That's why I asked you to be on the show. I'm a big fan of your writing. So you're an old soul. I love your spirit. You're just a cool kid, and I know you're going to crush it in dentistry.
Thank you, Howard. Have a good day.
All right, you too.